Today we are going to see about isolation of the operating field. So contents, we have goals of isolation, means of moisture control, you have direct method where rubber dam, cotton roll, gauze piece, absorbent wafers, suction devices, retraction cords are used, as well as surgical methods of gingival retraction is used. Then you have indirect methods, you have drugs and other materials. So, introduction. Complexities of oral environment present obstacles to the operating procedures, starting from diagnosis till the final treatment is done. While performing any operative procedure, many structures require proper control so as to prevent them from interfering with the operating field. So, there are various components of the oral environment which needs to be controlled during your operative procedure, such as your moving organs, tongue, mandible, lip and cheek, gingival tissue, floor of the mouth, buccal and lingual vestibule, etc. So, sources of moisture in the clinical environment include saliva, then blood, gingival crevicular fluid, water source, that is rotary instruments during cutting, air water syringe. Then goals of isolation, first is moisture control, retraction and access, harm prevention, safe and aseptic operating field, prevention of accidental swallowing of the restorative materials and instruments. So these are the methods of isolation using rubber dam. So main advantage of isolation is patient related. It provides comfort, protect from swallowing or aspiring foreign bodies, and protect soft tissues by retracting them. So advantages of isolation operative related is dry and clean operative field, infection control, increase accessibility to operative site, improved properties of restorative materials, improved visibility and less fogging of mirror. It prevents contamination of tooth preparation. So classification, you have direct methods, you have pharmacological methods and methods used for gingival tissue management. Pharmacological methods, you have anticelluloids, anti-anxiety drugs and muscle relaxants. So you have fluid absorbing materials, equipment used for evacuation of fluids and debris. You have tissue retractors and protecting devices. So methods of isolation, direct method, you have rubber dam, cotton roll, gauze piece, suction device, gingival retraction cord, mouth prop and mouth mirror. So rubber dam was introduced by Barnum. The main advantage of rubber dam is it provides a dry operating field, effectively retracts the tongue and cheeks away from the operating field, saves time, reduces the chance of injury to soft tissues, etc. The disadvantage is that it takes time to be applied, communication with the patient can be difficult, incorrect use may damage the porcelain crowns or gingival tissues, and insecure clamps can be swallowed or aspirated. So contraindications of rubber dam is patient with upper respiratory tract infection, congestion of nasal passage or nasal obstruction, presence of some fixed orthodontic appliances, recently erupted tooth, and patient with allergy to latex. So these are the armamentarium of rubber dam placement. Then you have your rubber dam sheet. Then you have your rubber dam template with a marking. Then you have rubber dam clamp or retainer. Then there are two types of clamp. One is winged clamp and other one is wingless clamp. In winged clamp you have central wing and anterior wing. So these are the different types of clamps. So these are the other types of clamps and these are the different types of retainer. So you have two types of retainer. One is flat jaw clamp and other one is tilted jaw clamp. So you have rubber dam clamp or retainers. Then you have your rubber dam punch. You have markings. In the marked template, you need to place the sheet and you have to mark it and you punch using your rubber dam punch. Then you have rubber dam forceps. It is used for placement and removal of retainer from the tooth. Then you have dental dam frame. So the rubber dam napkins. Then dental dam placement technique. You have single unit method. You have clamp first method, dam first method, split dam method. So this is a single unit method. So this is an image of single unit dam placement. So this is how it looks. So next is the clamp first method. So clamp is first inserted method for dental dam placement. So this is how it looks after the placement. So next you have your split dam method. So preparation of split dam method, first punch 2 holes in the dam a few millimeters apart as necessary. Then slip the material between 2 holes and a split dam is created. So this is the image. Then occurring problem in rubber dam application. Excessive distance between 2 holes, too short distance between holes, off center arch form and torn rubber dam. So recent modification is Instidam, Handydam, Optidam. So this is Optradam. This is also an Optradam placement. This is also an Optradam. So first is an Instidam, next is Handydam, next is Dry Dam, then Optidam, and next one is the Optradam. So other isolation techniques are cotton roll, absorbance and use of saliva ejectors. So absorbance, several commercial devices for holding cotton rolls in positions are available. Then you have your throat shield. Throat shield are indicated when there is danger of aspirating or swallowing small objects. A gauze sponge is unfolded and spread over the tongue and the posterior part of the mouth. Then you have your suction tips where you have your saliva ejector and high volume evacuator. Then Swedopter. For isolation evacuation of the mandibular teeth, the metal saliva ejector with attached tongue deflector is used. Then you have your retraction cord. The retraction cord placed in the gingival sulcus to control sulcular seepage and hemorrhage. Most brands of retraction cord are available with or without vasoconstrictor, epinephrine, which also act to control the sulcular fluid. Then when the cord is correctly inserted, its mild physical and chemical effects achieve isolation from fluids, provide access and visibility. Next you have your mouth prop. A prop should be established, thereby relieving the patient's muzzle. So indirect methods, you have the drugs such as anti-sialogogues drugs such as atropine, anti-anxiety drug diazepam and local